If I could sum up Jewish Hospital in one phrase, it's committed people working on behalf of the patients.
It was about 3 o'clock in the morning, and the doctor walked in the room and said, "You know, I don't know how to tell you this, but you've got cancer." Your world stops right there.
She called me and said, "I hate to share this with you because it's your birthday, but your x-ray showed that you have lung cancer."
You hear the word cancer, it seems so far away from you, and then when it is you, it's really is like, it hits deep. Coming to Jewish, I knew that I would be in good hands.
Jewish Hospital was founded in 1850 as the first Jewish hospital in the country. Since the start, Jewish Hospital has opened its doors to people of all kinds and of all faiths.
Walking in the door, the very first person that I met was caring for me with TLC.
Everybody treated you like a friend, like you're almost family.
They treated me like we were friends forever, and they even brought me like a little cake and wrote me a handwritten note for like my birthday, is what they call when you get your transplant.
There were times, I'm sorry, but when Julie was so sick, the nurses were crying too because they liked her so much, and it was hard on them, and you could tell, you know, that their heart was really in their work. So it was so meaningful to us to have all of them care that much.
I think one of the strongest aspects of Jewish Hospital is our medical staff. We have some of the brightest and best physicians that I've met.
You really get to know them on a personal level. You know their kids' names, their dog's name. You really become not only their oncologist, but their family member. It's a very personalized approach to their care, which is very rewarding.
Even though you may have a good cancer treatment, is a person or a patient is ready for it. So how can we prepare them?
I tell my patients that surviving cancer treatment here is the bare minimum. I want to see them thriving throughout their cancer treatment. I think that impacts the patient's experience, the family's experience, the treatment outcomes.
Donations to the Mercy Health Foundation help families and patients really focus on just getting better. But we also help the market with equipment and research and things that are really going to make a difference for healthcare overall.
Some of our patients are among the first in the entire world to receive some life-saving treatments. Some of the cellular therapy that we're offering here at Jewish Hospital, you cannot find anywhere else in Greater Cincinnati.
It's so exciting to see the research that is happening and to be able to be a part of that and to see the difference in making in these patients' lives.
We are now seeing that we are able to diagnose lung cancer quicker than we used to 5 to 10 years ago because the technology allows us.
The cancer care is also evolving. We are doing the same surgeries in much faster way.
Unfortunately, more cancers are going to increase or double increase over the next 5 to 10 years. So I think what gives me hope is what we've accomplished already. We're going to be positioned to really be able to take care of those patients because of our commitment now. When we take out a lung cancer, we essentially, in many cases, we cure them. And also when we take out an esophageal cancer, in many cases, especially nowadays with newer therapies, we're curing them.
Knowing that my surgery would be sometime in November, at first I thought, okay, let's just hold off, because I wanted to have that Thanksgiving with my children and my grandchildren. And when I met Dr. DePerna, and he said to me, "Why do you want to wait? We need to get this done, so on Thanksgiving you will be cancer-free." He was able to go in, extract it, and my cancer did not spread. As proactive as what Dr. DePerna and the Mercy Hospital team was for me, I'm going to have many Thanksgivings and Christmases and holidays with them.
Her biggest legacy is her family that she's left. We have 3 boys who love her and loved her so much, but I think the legacy at the hospital, again, just is to try to make it a comfortable atmosphere. The mural we put on the wall going into the unit, Julie loved tulips and butterflies, and so something that at least makes you a little brighter experience. So ultimately, that's what I think Julie would have wanted.
One thing I'd like to share is that the donors who donate to the oncology program are a true blessing. I don't think that they realize the impact that their donation and their generosity has on a cancer patient.
I think sometimes to donate to a hospital or a mission, and you may not know exactly who you're going to help or how you're going to help them, but it all pans out and helps somebody some way.
I would just say thank you to all the donors who help. It really feels like you're getting like the top of the line care. To think about that, I've only been 1 year post-transplant, and now I'm like living life to the fullest. I know it's really cheesy, but that's exactly what I'm doing.
I guess the thing I would tell people is don't take life for granted.
We're able to uplift other people by giving. It just gives us all joy, and I think that that is a very special thing that we can all do.